So I wanted to spend some time today with you guys going through what I call creative ways to keep worker health and safety relevant to decision makers. In my career of just over 20 years doing environment, health, and safety as an industrial hygienist and as a science policy expert to some extent, I am always striving to be creative in how to maintain worker health and safety in front of our decision makers, whether that's just your boss who's your decision maker or a broader decision maker like somebody who writes policy. So the presentation today has two parts. First is me talking about what I did during my doctoral studies at the George Washington University here in Washington, D.C., where I'm currently located. And then I'll be talking a little bit more about IPC. And so again, the common theme is how do we keep worker health and safety relevant? And I will, of course, want all of you to help me to do that. And so there's a little bit of an ask involved with this presentation. Some topics that we'll cover today, as I just mentioned, it's kind of a two-part, but the first is going to be how I did work to integrate health and safety, worker health and safety considerations into life cycle assessment. So life cycle assessment is a way to evaluate potential impacts to human health and the environment. Workers are not commonly incorporated into this approach, and so we wanted to make sure they were. So this is a way of creating a novel, practical way to consider those impacts. The second part of the presentation will be about what I'm doing right now at IPC, which is a global trade association for electronics, in particular those who manufacture electronics, and how I can do a better job at my job, because I'm only 5 months here at IPC, and I want to do what I can to enable workplace protections at, in particular, small and medium-sized companies around the globe, with a focus on electronics. So when I was at the George Washington University in their School of Public Health studying for my doctorate, I was learning about life cycle assessment really on my own. It wasn't part of my studies, but it was something that really intrigued me as a possible tool that we could use in public health, specifically environmental and occupational health, to more broadly think about potential impacts to workers. And so, as I had just mentioned, life cycle assessment is this approach to evaluating and actually calculating potential impacts to human health, ecosystems, natural resources. And what it does, it's not risk assessment, it's not chemical alternatives assessment, it is its own beast, it is its own friendly beast, and it is going to take a product or even a service, but let's think about a product, whether it's the computer in front of you or your phone or a pen or even a piece of paper or something more complicated, an automobile, an airplane, and think about that product from cradle to grave, from the resources, the raw materials needed that are taken from the earth or other resources to other places, manufacturing those and producing something out of them, distributing that, using them and maintaining them, and then managing them when they are at end of life, whether that's through recycling, reuse, repurposing, refurbishing, closing the loop and making them able to be used again, or good old waste disposal. And so we think about that product system, and we think about the inputs at each of those life cycle stages, like energy, water, land, chemicals, materials that are needed, and at each life cycle stage, the emissions, waste, and products that come out. And for all of those inputs and outputs, we can look at what is the potential impact to human health, ecosystems, natural resources related to those inputs and outputs. So it's a very powerful tool. Now, is it a highly accurate tool? Maybe not, but does it give you the ability to relatively compare those potential impacts? Yes, it does. So I thought, geesh, if we could be doing this, we can be improving the life cycle of a product, meaning maybe there's a specific life cycle stage where you see particular impacts to human health or to the environment. We can be targeting that life cycle stage to do something better, whatever that means, whether it's we need to change the chemicals, maybe we need to improve the energy efficiency. We can also be looking at a more broader, those inputs. Is that whole product system energy efficient? Does it require use of water in a place where water is scarce? And then how do you better manage outputs? So it's a really powerful tool. Great. What else can we be doing with this tool to improve public health, since we hadn't used this as a way to inform policy? Why would we perform a life cycle assessment, and who uses it? We can perform a life cycle assessment to quantify the releases to the air, water, land. We can compare impacts among products, and we can use that to inform design of a product. And folks who use life cycle assessment, it's a variety of folks, but in that science policy realm, if we want to inform a decision maker, those might be the decision makers who are regulating to ensure that in that space of product stewardship, where we're promoting sustainability, extended producer responsibility, polluter pays. Yes, it can be used elsewhere, but that was really my intention, was to target those types of audiences. So in my research, and what I always try to do in my jobs, in my life, is to make sure that occupational health and safety, or worker health and safety impacts, are considered, that we can quantify them, that we can think about them. So I wanted to make sure that these impacts could be quantified in a product's life cycle, and that I was thinking they could be potentially greater than some of those other environmental impacts that are often considered by decision makers. And that a decision made in the absence of comprehensive relevant occupational health and safety information may result in false optimization and problem shifting across the life cycle, because we haven't put everything into that big model that we could. We've only considered really good things related to the environment and environmental health, but we haven't considered all things. And so we may optimize to improve environmental health at the expense of the workers in the work environment. So again, exactly that. Why would we integrate work environment into life cycle assessment without that holistic view, that comprehensive view? Decision makers who would use these results could favor one thing and at the expense of another, in particular work environment and the worker, which frankly, I get tired of. I get tired of these folks forgetting about the workers, especially to some extent, we're all workers. Okay, so there was a little bit of a passion advocacy role in there for me to say, come on, let's do this better. So this is just a, how did I do it? This was one of many steps. I'm not giving you a full dissertation defense, but to integrate work environment into LCA, I was working to mimic what we often already do in life cycle assessment, even though that wasn't intended for or designed for workers and worker health impacts. Heck, you could put anything into that model, right? Let's just build a metric that you can add to the model that then will give you a result. And so the metric that I developed was a work environment disability adjusted life year. You'll be familiar with DALYs because the World Health Organization uses them. And funny enough, the life cycle assessment community also uses DALYs, not in the same way, but as a metric to indicate impacts to human health. So it's not really a measure of burden of disease as much as just a way to incorporate potential impacts to human health. So I said, well, instead of just a human health DALY, let's do a work environment DALY, which is very similar to that for human health. It considers the number of fatalities, the standard life expectancy, what would you expect if you were to live a full healthy life, and created this work environment DALY, the WHWB DALY, using available data from the Bureau of Labor Statistics, National Vital Statistics reports, a few different Bureau of Labor Statistics data that when I did my work, it was from 2000, it was in 2011, 2012, 2013. I was using data from 2005 through 2009. Doesn't matter, the point is that you can build out a WHWB DALY to consider workplace fatalities, non-fatal workplace injuries and illnesses, the severity of those injuries and illnesses, how many days away from work you may have missed, so that we can get a better understanding of, for each industry in the United States, for each industrial classification code, what do we see as impacts to human health? And then build that into a life cycle assessment model. This is a little bit black box, but because I'm not giving you all the details, to eventually end up with a lovely chart at the end of the day that this chart is a bit notional. This isn't exactly accurate, but where you can compare two types of things. In my case, I was comparing the landfilling of municipal solid waste with the incineration of municipal solid waste, and incorporating in worker health and safety impacts into a model that already included impacts to a whole bunch of other categories that we may be concerned with, but didn't look at workers. So I tossed that in. I put in that wee dally. I made the model run, did a lot of sensitivity analyses and a lot of uncertainty analyses in order to be able to say, indeed, we can make this a comparable value that can be incorporated and put on a similar scale to other impacts, such that when we are doing a relative comparison among or between products, we can now weigh in those impacts to the worker. This work, since I finished my dissertation, of course, always looking to do publications and other presentations. I know Mary learned about it because there were some researchers at a University of Michigan, as well as in Canada, who were doing similar work on building out that type of metric to be used within life cycle assessment. You can tie that metric to how much something is produced, you know, the weight of something. You can also tie it to the dollars. You can put it into input-output models that then inform life cycle assessment models. There's all sorts of ways to be creative in taking actual information we have about worker health and safety in the US, and it gets a little bit trickier abroad, but as surrogates, we can use US data to look at those potential impacts. So there's been a few other publications from some of my colleagues, and then most recently when I was with Department of Defense, we had much success in building out a life cycle assessment approach that included all sorts of impact categories that may be relevant to the defense sector or unique to the defense sector. And we made sure to keep advancing the worker health and safety measure that was incorporated into the model. So it's been nice to see a very slow yet forward moving momentum in thinking about life cycle assessment as a useful approach to thinking about public health impacts, and that within that approach you can expand it to include those types of impacts and those types of categories that are relevant to you. Great, okay. So into the second part of this presentation, I'm currently the Director for Environment, Health and Safety Policy and Research at IPC. IPC, again, is a trade association connecting over 5,600 electronics manufacturing companies across the globe. We have about half of our membership in the US and the other half not in the US, which would mean in a variety of places, Asia Pacific, India, and Europe mainly being the other locations. We represent companies that make electronics. So if you think about the computer or the phone likely in front of you or in your hand, the guts that are inside of that, the printed circuit boards, the assemblies, the stuff that makes it work is what we make. And that those parts, those electronics, can go pretty much anywhere, right? They're in your car, they're in your washing machine, they're in your healthcare devices, they're going to outer space, they're in defense, they're everywhere. And so the parts that our companies make are really important to a lot of different industrial sectors. So I'm excited to take on this new role because the environment, health, and safety aspects are global. It's related to something that, again, has application across many industries beyond electronics. And there's real stuff going on with electronics. We have real policies, standards, and regulations that affect how we are protecting human health and the environment. And there's new ones coming that we can be advocating for. I'm not going to go through this in great detail, but just IPC is first and foremost a standards development organization that began in the 1950s, really around printed circuit board fabrication. It was originally the Institute for Printed Circuits. It's now just IPC. And we do hundreds of standards around the design and development of electronics. We are also very much into the education of those who build our electronics and those who will build our electronics in the future. We do solutions, which means we're working with electronics industry members to find solutions to industry challenges, whether that's artificial intelligence or the movement to how to improve how we make electronics. And then advocacy, and that's where I work. I'm in the Global Government Relations team in Washington, D.C., and we are working with policymakers to talk about issues relevant to the industry. So in the few months that I've been here, I have been working on a variety of topics. One is just first, what is my job and what is the scope of my job? And so I've been working with members who have really basic compliance issues and questions related to environmental health and safety regulations, mainly environmental regulations. We are doing this also then, instead of just basic compliance, we also have a lot of proactive risk management, which means we're engaging with policymakers to educate and inform them about what we do in electronics and what are these EHS issues. I have already found that in just these few months, the worker health and safety aspect of my title and my job pales in comparison to the environmental health issues that I am dealing with, mainly again from the compliance or the proactive. I get a lot of questions about RCRA and about TSCA and about REACH and ROS and WE. So these regulations that are altering how we manufacture electronics or use them. So, or dispose of them. But I'm not getting a lot of questions about worker health and safety, and I want to make sure that that does not fall off my radar screen, because there are concerns, there are challenges, there are policies that are out there and that are evolving on the global scale that I want to tap into. When I first joined, International Labor Organization said, made their big announcement about World Day for Safety and Health at Work, and had released their big report and their big push for kind of the annual observance of safety and health at work. And I was really excited about that, and I wrote a blog post about it and posted it. But that's all that I've been able to do. And so I wanted to use this opportunity with you guys to say, what more can I do to do that compliance thing, which is kind of, well, who wants to do compliance? Let's get out ahead. I don't want to have to worry about compliance. I want people doing the best thing they can be doing to protect worker health and safety. And then what more can I be doing to proactively prevent impacts to workers in the work environment? So I know that there's grants available, there's opportunities to convene, and so we don't have to necessarily finish that conversation today. I wanted to actually just open the floor to saying, please help me do my job. What do you guys know about electronics? Who else do you know that I can connect with? What more can I be doing to connect with you guys now and into the future?